My topic is about the effects that sleep deprivation has on humans, and the goal of this presentation is to learn more about and inform others about the effects that sleep deprivation has on the mind and body. When it comes to not getting enough sleep, people know and feel the common effects such as being distracted, having slower reflexes, and reduced focus. But there are also many lesser known effects that are more severe, and they come along with lack of sleep. With so many people being busy in their lives and juggling many tasks, it can almost feel impossible to get sufficient sleep every night. Whether it's balancing school, work, life, everything else, everyone at some point feels that it's impossible to get enough sleep every single day. For these reasons, it's also important that everyone knows the lesser known issues that come along with insufficient sleep, such as hypertension, obesity, and depression. There are countless easily accessible studies that show that these negative effects on the body are influenced by a lack of sleep. Due to their severity, it's important to be aware and take action sooner than later. High blood pressure can damage your arteries by decreasing the flow of blood and oxygen to your brain and heart. Obesity can increase the risk of many other diseases and health problems. Depression can have negative effects on a person's life, such as relationship and family problems and difficulty with daily tasks. And let's begin with how sleep deprivation is linked to hypertension. Medical professionals sometimes refer to high blood pressure as the silent killer because it can go undetected for a long period of time and it can lead to death eventually. Because of this, it cannot be stressed enough how important it is to recognize how it links to sleep deprivation. According to the National Library of Medicine, an insufficient amount of sleep causes chronic elevation in daytime blood pressure. The likelihood of hypertension is greater within patients who do not get sufficient sleep. Studies show that approximately 30% of patients diagnosed with hypertension turn out to have sleep apnea. This evidence from several studies reinforces that it isn't just a coincidence, but the two variables are linked together. Additionally, according to Cleveland Clinic, over 70 million Americans are sleep deprived, which displays how relevant the issue is. In simple terms, the research states that when a person is sleeping, there's a 10% drop in blood pressure. If we're not sleeping well or not long enough, that drop won't occur, and this rise in blood pressure can put extra strain on blood vessels, the heart, and other organs. Moving on, research also has shown that there's a link between sleep deprivation and obesity. As previously mentioned, obesity provides an increased risk for many serious health problems such as high blood pressure, high cholesterol, type 2 diabetes, and much more. According to Brown Health University, the link between sleep deprivation and obesity comes from a hormone imbalance. This imbalance promotes overeating and weight gain, daytime fatigue, which makes you less motivated and tired sooner, and a decrease in your resting metabolism and the energy you burn. Essentially, the less sleep you get, the more calories you retain, the less energy you have, and the more fatigue you have. In addition, the National Library of Medicine states when a person sleeps less than 7 hours a night, there's a relationship between the sleep loss and obesity. The more sleep you lose, or the shorter the sleep, the greater the obesity in terms of BMI. Judging that obesity is a way for many other problems to enter our lives, it's crucial that we get enough sleep every night.